Hello, my name is Tamisha Thomas, and I will be doing a presentation on schizophrenia. What is schizophrenia? Schizophrenia is a chronic neurological disorder that affects a person's way of thought, feeling, and behavior. Schizophrenia patients may seem to have lost contact with the truth, which creates tremendous problems for people, their families, and friends. What are the symptoms of schizophrenia? The symptoms are hallucinations, delusions, disorganized thinking, lack of motivation, slow movement, change in sleep patterns, poor grooming or hygiene, changes in body language and emotions, and lastly, less interest in social activities. As you can see in the picture, there are two different types of symptoms. There's positive and negative, and an example of the positive are the hallucinations, and an example of the negative is the reduced speech. What is the cause of schizophrenia? The exact cause of schizophrenia isn't known, but a combination of genetics, environment, and altered brain chemistry and structure may play a role. In certain situations, a traumatic incident may cause the condition, such as your loved one's death or a work loss. What are the different types of schizophrenia? The different types of schizophrenia are paranoid schizophrenia, hebephrenic schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, and residual schizophrenia. Paranoid schizophrenia includes delusions and hallucinations. It is characterized by positive signs of schizophrenia. These diminishing signs obscure the distinction between the right and the false, which makes it hard for the person to live a normal life. It also may develop at a larger age than other types of schizophrenia, and speech and emotions may be unaffected. Hebephrenic schizophrenia or disorganized schizophrenia is characterized by shallow and unsuitable thoughts, bizarre or dumb behavior, mistaken convictions, and false expectations. This type of schizophrenia can cause pranks, giggling, health complaints, and grimacing. This schizophrenia usually develops around the age of 15 through 25. Catatonic schizophrenia. Catatonic affects the way you move in extreme ways. You might stay totally still and mute. This schizophrenia is rarer than others. Undifferentiated schizophrenia is the classification that a person who cannot adapt to any of those other schizophrenia classifications when they have more than one form of symptom. The positive and negative symptoms of these patients will occur. Residual schizophrenia. Your diagnosis may be delusional, hebephrenic, or catatonic schizophrenic, but certainly does not match in with one such type alone. The treatment for schizophrenia. You may be given medications called antipsychotics by the doctors. This decreases schizophrenia symptoms but do not cure the condition. Treatment typically lasts for a lifetime, often requiring a combination of medications, psychotherapy, and coordinated programs for advanced care. And lastly, for psychological treatments, 1. Family therapy can decrease expressed emotion. You can teach your family about causes and symptoms and talk about the importance of your medication and enhance family communication and problem solving. So that is the end of my presentation. Thank you.